Welcome to today's FERNE learning session on brain biomarkers and the evaluation of ED patients with mild traumatic brain injury. What is the pathology? What is the clinical benefit of this diagnostic test? And what role does this lab have in 2026? My name is Edward Sloan. I'm Professor Emeritus in the Department of Emergency Medicine, U of I in Chicago. I'm also Medical Director of the Physician Assistant Studies Program at Dominican University in River Forest, Illinois. This is the QR code for my information, and I want to thank the people from the Emergencies in Medicine Educational Group who helped provide this original presentation. I have no financial conflicts. I'm FERNE President and Board Chair. You can join us at ferne.org or on social media. And at YouTube, you can join us at FERNE.org, where we have several different playlists, shorts, and longer presentations. This information is available to you using this QR code, and there is extended information including a policy brief, clinical update, and mild traumatic brain injury patient information using this QR code. So what are our educational objectives when considering patients with mild traumatic brain injury? We want to look at the TBI biomarkers pathophysiology, look at the platforms, the patient populations for whom it's intended, the indications for this test use, the performance and utility of these tests. And we want to examine some specific issues related to clinical use, including confounding clinical factors, clinical effectiveness concepts, cost and reimbursement issues, and what are clinical adoption issues. And at the end, we'll develop some conclusions and recommendations regarding the clinical use of these brain biomarker labs. So what is the methodology we used in developing this information regarding brain blood biomarkers and neuroimaging in mild traumatic brain injury patients? The lecture content, the references were originally sourced from a previous lecture presentation by me on this subject. I then went to Copilot asking it to provide a PICO table generation, including population, intervention, comparisons, and outcome. And from this PICO table, Copilot generated a PubMed search string that was restricted to get the best articles related to this topic. I then used PubMed to find and screen for relevant sources for this lecture. So, what were the clinical questions that we utilized when trying to develop material? Using 30 to 50 sources, which were put into Google Notebook LM, I asked for key concepts using the structured format. I asked the questions, what would be a 3-minute presentation of the current state of the art on this topic? And I said, if an emergency clinician said, so what is the deal with biomarkers in diagnosing the need for a non-contrast CT in my mild traumatic brain injury patients who have a history of head trauma and possibly concussion symptoms? Also, I asked, how do they improve the cost of care, and why should I specifically as a clinician care about this lab test system at all when I can simply get a non-contrast CT? So these were the questions that we utilized when addressing this topic. When you take a look at Notebook LM, this mild traumatic brain injury folder is just one of many folders I have saved that include information related to topics of neurological emergencies. When you go to the studio, you can see on the left here are the many articles that I can choose from when asking questions. And on the right, information is being saved as I produce it, so I can go back to that information. And if you click on any one of these items on the right, you then will go back to the information that was provided when the original Notebook LM search and information production was provided. So what is a typical clinical case regarding the use of brain biomarkers in mild traumatic brain injury patients? Here's a representative clinical case. A 35-year-old male presents to the ED 6 hours after a fall from a skateboard. He struck his head. He had a momentary loss of consciousness at the scene, mild headache, and one episode of vomiting that occurred en route to his home and prior to arriving in the emergency department. His Glasgow Coma Scale score is 15. His neurological exam is non-focal. And based on clinical decision rules, such as the Canadian CT head rule, imaging may indeed be indicated due to loss of consciousness and vomiting. But given his otherwise low-risk clinical profile and a short duration of symptoms, a GFAP and UCH-L1 biomarker test is drawn. And the question is this: if the biomarker test is negative, can we safely defer the non-contrast CT scan, reducing his radiation exposure and allowing his discharge from the ED to occur sooner and with less healthcare costs? For more information, go to FERNE.org, where you can find content relevant to your clinical practice. We're also available on social media and on YouTube at FERNE.org. You can find playlists and video content that will improve your patient care, patient outcomes, and your clinical practice. So with that, I'd like to thank you. And if you have any questions, you can email me at my email below, and always go to FERNE.org for finding more information regarding how these tests and other strategies for providing optimal patient care will improve patient outcomes and allow for us to optimally utilize our limited healthcare resources. Thank you again for participating in this educational program.